MDNews Network recently attended the Medical Group Management Association's annual conference in New Orleans, where our cameras focused on Dr. David Blumenthal, National Coordinator for Health Information Technology with the U.S. Department of Health and Human Services. Here's what he had to say about health information technology.
Well, the Office of the National Coordinator was tasked by the Congress and the administration with leading the development of a nationwide, interoperable, private, and secure electronic health information system. Now, that's a big phrase, but it really means making it possible for clinicians to make the very best use of the information that is available about their patients. And in the 21st century, mobilizing, collecting, managing, organizing information, using it in the day-to-day decision-making about your patients really means getting online into the business of electronic health systems. We are connected 24/7. We all carry our cell phones and our Blackberries, and our kids are online all the time, and I just don't think our patients are going to understand very much longer why we are not with the rest of society in terms of using electronics to get better value for them. Well, we have a Health Information Technology Policy Committee, which has many physicians on it. We have many other work groups that advise us, and they almost all have physicians, and we're trying to make sure that it's a representative sample of physicians representing small practices and large practices, different specialties. We also represent a lot of other stakeholders in this change. So physicians are one of the very important audiences. We have many others as well. First of all, from the representatives of physicians, the major groups, we hear a lot of understanding and support. I don't think there's any question among American medicine's leaders that this direction is inevitable, that this change is inevitable, that it's just a matter of making it as easy as possible and as effective as possible. So that's really our goal. We don't have any doubts about where we're going to end up. The question is how to make it possible for small practices, less technologically savvy physicians and other clinicians to make this transition as easy and efficiently as possible. So mostly what I hear is, we know we have to do this, but we know it's hard. How can you help us? And that's what we're in the business of doing. We're in the business of helping doctors, hospitals, nurses, other clinicians become effective users of electronic health systems. I'm a primary care physician, and the reason I'm in this business is because I use an electronic health record, and I saw it change my practice. I saw it make me a better doctor. I saw it make me more aware of my patients' problems, better able to respond to their questions, more knowledgeable about their conditions, better able to cover for my colleagues on weekends, able to avoid unnecessary testing, avoid allergies and mistakes that might have been really detrimental to my patients. I saw it change the practice of medicine for me, and I have no question that this is a technology which will bend the quality curve up and bend the cost curve down, and do it in a way that's totally consonant with the professional ethic, totally under the control of physicians, totally comfortable for them once they get used to the technology.
Now that you've heard what the MGMA conference attendees have to say, we want to know what you think. Click on Share Your Perspective at mdnews.com to let us know.